Responsibilities of the dietitian. Karina states that the dietitian's major role is in medication education, assessment of nutritional status, and nutritional education. Nutrition plays a major part in the overall quality of life for a dialysis patient. As mentioned, because the dialysis treatments are only performing about 15% of the kidney's functions, less if a patient is not compliant, electrolytes are not in natural equilibrium. Eating foods that are high in potassium, which controls muscular function, can lead to a heart attack. Therefore, eating bananas, spinach, salmon, and sweet potatoes are contraindicated. A high intake of phosphorus results in calcium being drawn out of the bones, making them weak and brittle, and affecting heart and brain function. Everyday foods such as dairy products, beans, and chocolate will raise the phosphorus level in the blood. As phosphorus is so easy to overly ingest, expensive medications called phosphorus binders are prescribed to ESRD patients to absorb the electrolyte. A high protein diet is essential to the health of renal patients. This macronutrient raises the albumin levels, keeping fluid inside the bloodstream and out of the tissues, enriches the red blood cells, protecting the patient from anemia. These are just a few of the major components of nutrition that the patient must maintain, and Karina has a one-on-one with patients at least monthly for review, more if their lab values indicate the need for attention. Obstacles viewed by the dietitian. Per Karina, a reoccurring issue for the patient that affects clinical outcomes is prescription coverage. As mentioned, phosphorus binders are necessary and they are also expensive, according to the National Kidney Foundation, costing Medicare Part D in excess of $1.5 billion in 2015. Many patients are surprised by an ESRD diagnosis and present to the clinic without coverage. The major dialysis companies have helped to alleviate this issue by forming their own pharmacies and utilizing prescription assistance programs. Regardless of the education given around nutrition and medication, the dietitian has no control over what the patient actually eats, often having to recurrently review the same information with the same patients. This not only affects the health of that individual, but the overall clinical quality. Karina notes that because patients typically fall into the world of renal care following a hospitalization related to complications, they don't present with much education or preparation on their chronic illness. David agrees. As the social worker, which is equivalent to a case manager, David assists with education around and referrals for transplant, as well as a guide for coping with and adjusting to dialysis treatments, which oftentimes comes with rejection, anger, and fear, for which the social worker provides short-term counseling.